Here's what we do when a prisoner comes in to give birth from a labor and delivery nurse. First, we do not call them prisoners. We call them by their name, like literally everybody else that we take care of. I'm going to be just as attentive, treat them the same way as anybody else I'm taking care of. At the same time, it's no secret they are incarcerated. This is information we need to pass along from one staff member to the next, just so that we can manage and coordinate their care accordingly. But when I'm giving a report to the next nurse, we usually just say they're incarcerated. Second, when an incarcerated mother does come to our unit, usually, yeah, she is in handcuffs, and she absolutely will have guards, staff members from the facility, the correctional center, staying with her 24/7 at all times. And that includes the birth. We do try to maintain a level of privacy. So, we have curtains that are drawn, or some of our rooms have sort of a half wall. They can stay there if we're doing really, really private things. That way they're present in the room, but we can also maintain like dignity, privacy to the fullest extent. Also, if guards is not the correct term, I truly am sorry. When she's admitted, in most cases, she does not have to stay in handcuffs the entire time. From there, honestly, to me as a nurse, it feels absolutely zero different whatsoever than taking care of anybody else. We vibe, and I want to know, are we doing formula? Are we doing breast milk? Would you like to do skin to skin? What are your plans for pain management? Cutting the cord can be a little bit tricky because she is not able to have a visitor. She's going to be doing this on her own with whatever guards and whatever staff are present at that moment. So which staff member will cut the cord? Yes, she can have an IV. Yes, she can have pain medications, narcotics, epidurals. Yes, she can get up out of the bed, move around the room, use a birthing ball, all the other things. As long as she and her baby are safe and stable, pretty much everything else looks the same. When baby is here, baby stays with her 24/7 unless there are other arrangements or some sort of a scenario where that is not safe. She cares for baby, feeds baby. This is her baby. And I educate her on postpartum, breastfeeding, pumping, whatever she needs to know, warning signs, things to look out for. And then the time comes when she is being discharged. And honestly, it's really, really, really hard for everybody. I always cry, not in front of them, privately. She needs to go back without her baby. She chooses somebody, she's elected to care for baby. Oftentimes it's maybe a parent, it could be a family member. When we're gearing up to that time, I like to make sure she has a really good special moment with her baby. We have a phone in our unit. I take pictures, photo shoot of her and her baby, and fingers and toes and hair. I print them off. Sometimes they can't have actual printed pictures. It has to be printed on a sheet of paper. It all has to be processed. And then she leaves and she has to say goodbye, and it's a hard one, whether you agree with it or not, and I don't really care if you do. I 1000% will not treat them any different than anybody else I take care of. And it really is heartbreaking when they have to go home.